diagnosis, the treatments, preventions, statistics. I will be going over an experiment on future research of West Nile virus, bibliography, acknowledgements, and then I will open the floor for questions. West Nile virus. West Nile virus is a type of flavirus, and a flavirus is part of the Flavariae family. Other diseases that originate from flavirus are yellow fever, Japanese encephalitis, dengue, St. Louis encephalitis, and tick-borne encephalitis. Flavirus is found in temperate and tropical regions of the world. This picture right here is a TM micrograph of the flavirus, and the yellow is the virus. What is West Nile virus? West Nile virus is a disease that's transmitted from mosquitoes to humans, and it's a neurological disorder, and for this reason affects the central nervous system. It affects birds, humans, and other vertebrates. And it was first originated in Africa, and before spreading to the Western Hemisphere, it was found in Eastern Europe, Western Asia, and Middle East. This diagram shows the picture of the West Nile virus transmission cycle. The virus usually cycles between mosquitoes and crows, but sometimes when a mosquito feeds off a crow, it can spread the virus to humans, other vertebrates, such as mainly horses, and other birds, mainly blue jays. There are other ways for transmission of West Nile virus. One is blood transfusion, organ transplant, exposure in laboratory setting, and from mother to baby during breastfeeding, delivery, or pregnancy. And these cases are rare but can occur. The history of WNV. WNV was first identified in Uganda in 1937, and it continued to develop in North Africa, East Asia, Middle East, and the Mediterranean Europe before spreading to the Western Hemisphere. The first case that was reported in the Western Hemisphere was on September 1999 in New York. The symptoms of West Nile virus. There are three categories of symptoms of West Nile virus. One is asymptomatic, mild, and severe. 70 to 80% remain asymptomatic, and for this reason they don't show any symptoms, and this can be good because they will not be affected by the virus. 20 to 30% will develop mild symptoms such as a fever, headache, body aches, nausea, and diarrhea, and joint pains. And 1% will develop a serious neurological illness. Two main serious neurological illnesses that can develop from West Nile virus are encephalitis, which is the inflammation of the brain, and meningitis, which is the inflammation of the protective membranes covering the brain and the spinal cord. There are other severe symptoms that can occur, such as muscle weakness, paralysis, photophobia, which is a fear of light, seizures, mental status change, respiratory symptoms such as difficulty in breathing, rashes, which can be seen on the leg, neck, or arms, and a coma, which is rare. Cranial nerves can also get damaged, which may result in facial weakness, double vision, and decreased taste. And this picture right here is the cranial nerves that are found in the brain. Diagnosis of West Nile virus. Diagnosis of West Nile virus is improved due to the rapid increase of infections. And there are many ways to diagnose WNV. One is isolation of the agent of disease. And another one is viral culture. It is when a test in which samples are placed with the same cell type that the virus is being tested for and is able to infect. And RT-PCR, which stands for reverse transcript polymerase chain reaction, which is more expensive than viral culture but is preferred. MRI is used to test WNV when the symptoms are severe and have reached their final stage, and it's always followed by performing PCR. Treatments of West Nile virus. Currently, there is no vaccine or specific antiviral treatment for WNV. So when you get mild symptoms, you use over-the-counter pain relievers, and when you get severe symptoms, you have to go to the hospital to be hospitalized and receive intravenous fluids, pain medication, and nursing care. Preventions from WNV. Reducing, since there's no cure, probably preventing yourself is the best way from not contracting the virus. And one is reducing or eliminating mosquito breeding grounds. And this can be stagnant water, water from flower pots, gutters, buckets, pool, covers, pet water dishes, discarded tires, and bird baths. Covering as much skin as possible will also keep mosquitoes away from you, and avoiding the use of perfumes and colognes. Also, using insect repellent is probably the easiest way to prevent from getting WNV. The statistics. There has been many surveys that have been conducted to find out the statistics of West Nile virus, since it's a rapid increasing infection, and they're not able to diagnose every case, and not all the cases are reported. So one survey that was conducted was the seroprevalence survey, which was conducted in the United States to determine increasing infection rates. After the 1990 epidemic, which was when the first case was reported, the survey was conducted, and it reported that of each case of West Nile virus resulted from an average of 140 infections. In 2006, the survey was once again conducted, and it showed that for every West Nile virus case that was reported, there was 256 to 263 infections. In 2007, the survey was once more conducted to see if statistics have changed, and they found out that for every case of West Nile virus, there were 213 to 286 infections. This chart right here shows another survey that was conducted, and this was a cumulative survey, so that means it showed from when the disease was first seen in the Western Hemisphere until 2012. And it showed how many cases were reported and the total deaths. There were 37,088 cases that were reported in total from 1999 to 2012, and out of that, it resulted in 1,549 deaths. Those cases and deaths were later categorized into two different groups. One was neuroinvasive and non-neuroinvasive. Neuroinvasive means it affects the it's a neurological illness, and it affects the central nervous system. And neuroinvasive cases were 16,196, and out of that, 1,443 deaths. Non-neuroinvasive were 20,892 cases, and a total of 106 deaths. One more survey that was conducted was to see if age and gender does affect if you get WNV. And the risk of WNV is 20 times higher in men aged over 65 than women aged over 65. Now we'll move on to my experiment. The experiment that I will be talking about today is to see if persistent infection with West Nile virus will continues to show symptoms after the virus is said to have been eliminated from your body. The purpose of this experiment was used to see if people who had West Nile virus continue to experience persistent symptoms of the virus once the virus has been eliminated. The background of the patients that were tested in this experiment were that they had been diagnosed with West Nile virus and syphilitis 1 to 6 years previously before the virus, the experiment was conducted. And some of them have complained of ongoing symptoms. The procedure. The 25 patients were chosen following the background of the patients that they had to have West Nile virus and syphilitis 1 to 6 years before the experiment was conducted, and a questionnaire was filled out. The urine of the 25 individuals were taken and tested to see if West Nile virus still exists in them. The results showed that the urine of 5 out of the 25 individuals were positive, and those who tested positive were the ones who complained of ongoing symptoms. The conclusion. The outcomes of the study suggested that in some people, West Nile virus may continue to persist in the kidneys, the brain, the spinal fluid, and the blood of ones diagnosed with WNV. Future research of West Nile virus. Since there currently is no cure for West Nile virus, they're still trying to find a cure, and they're trying to find better suppressants for the symptoms that can be seen, and a better diagnosis for WNV. This is my acknowledgments, my bibliography, and thank you for listening.
So, if there are mild symptoms and severe symptoms that determine it's not the same infection, like is it?
It is the same infection. It's just some people show mild symptoms and some people show severe symptoms.
Can you explain the process of reverse transcriptase PCR or polymerase chain reaction?
For reverse transcription PCR, it's when the RNA is converted to cDNA, and then the cDNA is then amplified to see if the person has West Nile virus.
What does the word seroprevalence mean?
Oh, I'm not exactly sure. It was a survey that was
You mentioned paralysis. What is that?
It's when some of your nerves stop working and you can't move.
Any other questions?